After studying this module, you shall be able to know and understand the concept of pervasive developmental disorder, identify the clinical picture and etiology of the disorder, learn about the various methods of treating the disorder. Introduction. Pervasive developmental disorder is one of the serious disorders that is difficult to understand and treat, as people with these disorders experience a wide range of problems related to socialization, language, and cognitions. The word pervasive reiterates the fact that this disorder lingers on throughout the lives of the affected individuals. Examples of pervasive developmental disorders are autism, Rett disorder, Asperger's syndrome, and childhood disintegrative disorder. The focus here is on the two of the more prevalent disorders, autism and Asperger's disorder. Pervasive developmental disorder makes up about 3.2% of cases seen in inpatient setting. Swart, Shade, Fuzz, and Levine, 1995. They are considered to be the result of some structural differences in the brain that are usually evident at birth or become apparent as the child begins to develop. Siegel, DSM-4, TR or ICD-10 have a fairly good diagnostic determination of pervasive developmental disorders in children. Several pervasive developmental disorders are covered in DSM-4-TR. Asperger's disorder includes marked stereotypical repetitive behavior and inflexible adherence to routines, which result in a severe and persistent impairment in one's social interaction. Massibo, Shea and Adams, 2000. This pattern of behavior usually appears later than other pervasive developmental disorders such as autism. It is nevertheless leads to a long-term psychological disability. Asperger's disorder shares many features of social impairment disorder, but in most cases it is not associated with the severe delay in language development and social interaction that autism does. Kozum, Elgabala et al. 2004. Asperger's disorder. Asperger's disorder, named after Hans Asperger, who is 1994, described the syndromes as being less severe with few communication deficits than autism. It is thus a mild form of the latter. Stereotyped behavior is found to be intense and social relationships are poor. However, language and intelligence is not affected in patients with Asperger's disorder. It is unclear that whether Asperger's is qualitatively or quantitatively different from autism. Autism and Asperger's disorder are considered two types of pervasive developmental disorder, a term first introduced in DSM-3. Diagnostic criteria for Asperger's disorder. According to this DSM-4-TR, qualitative impairment in social interaction is reflected as the manifestation of at least two of the following in the individual's behavior. First, nonverbal behavior as reflected through facial expressions, eye gaze, and bodily postures have significant impairment. Second, inability to develop meaningful relationships with peers as per their level of development. There is a significant lack of spontaneity to share enjoyment, interest, or achievements with other people. Absence of social or emotional based reciprocity in relationships. Further, there is a stereotypical and restricted repetitive patterns of behavior as reflected in one's behavior, interest, or activities, manifested by at least one of the following: persistent preoccupation with one or more restrictive or stereotypical patterns of interest that is abnormal either in its intensity or focus, an overtly inflexible adherence to specific routines which are apparently non-functional. Persistent, repetitive, and stereotypical patterns of behavior reflected in motor mannerism of the individual, basically through complex body movements. Continual and persistent preoccupation with certain objects as a part of such object. These persistent and repetitive patterns of behavior cause significant disturbances of one's social, occupational, and other areas of functioning. Further, there is a marked delay in development of adaptive behavior, curiosity regarding the external stimulus, and cognitive development of the individual. Above criteria not being met for another specific pervasive developmental disorders or schizophrenia. Sources: with permission from American Psychiatric Association 2000, Diagnostic and Statistical Manual of Mental Disorders, 4th edition. Clinical description of autism. Autism was first identified by Leo Kanner, a psychiatrist at Johns Hopkins University. Studied the behavior of 11 disturbed children who behaved in a way that was uncommon among children with their age. The behavior of these children was characterized by an extreme autistic aloneness, which led him to naming this disorder as autism. Kanner, 1943. Autistic children exhibit a large, wide range of problematic behavior, including deficits in language, perceptual and motor development, and inability to function in social situations. Autism is usually identified before the child is 30 months of age. Mothers often remember such babies as never being cuddly, never reaching out when being picked up, never smiling or looking at them. Social deficits and emotional disturbances. Autistic children do not show any need for affection and contact with other people. They avoid others and they do not understand social cues from others. Complete mind blindness is found in them. They see things as others see them. Few autistic initiates to play with others. These children have significant impairment in non-verbal behavior as they are unable to make eye contact and often unresponsive. Even when they do make eye contact, their gaze has a measure of a rather unusual quality. Further, these children do not display curiosity towards their external stimulus or environment and rarely gaze at other people to get their attention and to draw their attention to a particular object. Dawson et al. 2004. This is often referred to as a problem in joint attention, that is interaction, and it requires two people to pay attention to each other. Studies indicate that autistic children are unable to pay attention to others, which is further reiterated by no activation found in the brains of such children during these tasks. They are found less efficient in studying the emotions and expressions of other people, and they do not enjoy physical activity like wrestling and tickling, nor do they engage in symbolic play. If other persons initiate play, then they might engage in the activity but only for some time. Some of them may not be able to differentiate one person from the another, but may develop strong attachment to inanimate objects like keys, switches or blankets. And if the object is small in size, they may carry it around with them, which further prevent them from learning to do more useful things. Research shows how social awareness problem evolves as the children grows older. In one study, scientists showed an adult man with autism scenes from some movies and compared how he looked at the social scenes with how a man without autism do so. This is according to Klein, Jones and Walmar and Cohen 2002. This research suggests that people with autism may not enjoy meaningful relationships with others. Autistic children, they are unable to understand other people's perspective and emotional reactions. Intellectual ability. Autistic children do not perform well on cognitive and intellectual tasks. They are significantly impaired on memory tasks. They appear to have deficits in social reasoning, but they can manipulate objects. Some autistics, they are quite well at fitting objects, and their performance on puzzles may be average or above average. So when autistic children, they are shown pictures and asked to make a story about it, and they show marked deficiency in performance, communication deficits. Some autistic children show deficits in language, and some of them show deficits in communication, and they do not learn from imitation. 1/3 of these students, they never acquire speech. The ones who have acquired speech are often very unusual in much of their communication. Some repeat the speech of others, a pattern called echolalia, which referred to before as a sign of delayed speech development. If you say, "My name is Ram, what's your?" they will repeat all parts of what you said. "Ram is my name." And some of who can speak are willing to carry on further conversation with the others. Pronouns reversal is a common speech abnormality in autistic children, wherein they refer to themselves as a third person, as he, she, or you, or even by referring to themselves by their own name. And this abnormality is linked to echolalia, wherein they refer to themselves as they have heard others speaking to them, as a result of which they misplay pronouns. Restrictive behavior, interest and activities. Autistic children, they have restricted pattern of behavior, interest and activities. They like things to be the same. They become extremely upset if something or some small changes have occurred in their life, and this intense preference for the status quo has been called maintenance of sameness. When anything familiar in the environment is altered even slightly, these children may have a violent temper tantrum or crying spell that continues until the familiar situation is restored. So, autistic children, they are obsessed with the maintenance of sameness, and they spend countless hours in stereotypical and ritualistic behavior, making other stereotyped movements in circles, waving their hands in front of their eyes with their heads or cocked to one side. Self-stimulation. Self-stimulation is often characteristics of autistic children. They usually takes the form of such repetitive movements such as head banging, spinning and rocking, which may continue for hours. Other bizarre movements and repetitive behavior are typical. Autistic children seem actively arrange the environment on their own terms in an effort to limit interventions of other people, and they prefer instead a limited and solitary routine. DSM-40 are criteria for diagnosing autistic disorder. 6 of the following criteria, at least 2 from section 1 and 1 from the 2 and 3rd, that should be there if you want to label the child as autistic. So these symptoms should be there in the child. First is the qualitative impairment in social interaction as manifested by at least 2 of the following. First, presence of significant impairment in one's non-verbal behavior in the form of their facial expressions, body language, body postures and gestures and eye gaze, which regulate social interaction. Further, there is an inability to develop appropriate relations with one's peer. Second, lack of interest in sharing achievements and enjoyment with other people. For example, lack of sharing or pointing out objects or situations which spark curiosity or interest. Second, qualitative impairment in communication as manifested by at least one of the following. At least one symptom should be there in them. Delay or a total lack of development of spoken language in the individual, accompanied by a further lack of communication through alternative means of communication such as gestures. In individuals with adequate speeches, there is a significant impairment in the ability to initiate a conversation with others. Stereotyped and repetitive use of language, lack of varied and spontaneous make-believe play or social initiative play appropriate to one's developmental level. Restrictive pattern, impairment and stereotypical patterns of behavior, interest and activities as manifested by at least one of the following: preoccupation with one or more stereotypical and restricted patterns of interest that is abnormal either in intensity or focus, overt inflexibility to adhere to specific routines or rituals which are more often than not non-functional, stereotyped and repetitive motor mannerism, for example, hands or finger flapping or twisting or complex whole body movements. Then persistent preoccupation with parts of the object. Then delay or abnormal functioning in at least one of the following areas with onset prior to age 3 of their age. First, social interaction. Second, language as used in social communication. Or third, symbolic or imaginative play. Fourth edition text revision of American Psychiatric Association in 2000. Causal factors in autism, biological dimensions. Biological, psychological and social factors are implicated in the development of autism. Empirical evidences support genetic influences. Genetic factors contribute in the development of autism. It was found that in a family, if one child suffers from autism, there is a 5 to 10% of chances that the other child will also suffer from the same disorder. So it is not yet clear which genes actually lead to the disorder. Researchers are doing work on oxytocin because it plays important role in social memory and in our social bonding with the others. So there is evidence for some involvement with numerous chromosomes. Researchers are seeing whether these genes are responsible for these neurochemicals or neurochemicals are involved with the autism. Preliminary work identifies an association between autism and oxytocin receptor gene, Jacob 2007. Some researchers have pointed to the existence of a possible genetic defect known as Fragile X, a constriction or breaking of the end portion of the long arm of the X sex chromosomes that appear to be determined by a specific gene defect. The Fragile X syndrome occurred in about 8% of the autistic males. So in addition to that, 15 to 20% of males with the Fragile X syndrome are also diagnosed with autism, further suggesting a link between the two syndromes. Then neurological influences. Many neurological factors are being studied to help to explain in social and communication problems observed in autism. Researchers, they have found that the brain of adults and children with autism to be significantly larger in comparison to that of the adults and children without autism. So which have been supported by the further studies which use the measurement of one's head circumference as an indicator of a brain size. So these findings suggest that children with autism are, though they are born with brains of a relatively normal size, and they have, however, between the age of 2 and 4 have brains significantly larger than those children without autism. So this establishes the fact that a large brain size is not necessarily a good thing, as it indicates the neurons are not burned correctly, and the latter is essential for the maturation of the brain. So along with the large brain size, the brain growth of the autistic children is significantly lower in later childhood, which establishes a direct connection between the patterns of brain growth to autism. The overgrown areas of the brain are frontal, temporal, cerebral, which are linked to the language, social and emotional functions. 16 MRI and autopsy studies from 9 independent researchers, and they have found that abnormalities in the cerebrum of the children with the autism. So neurological abnormalities among autistic children suggest that in the course of the development, their brain falls to align properly and doesn't form the necessary connections found in normal brain. So it was also found that amygdala in autistic children was found to be larger in size, which is found to be associated with social and emotional behavior. Treatment of autistic disorder. Psychological treatment is found to be the most successful in treating autistic children, even more than prescription drugs as it improves their social and communication skills, which reducing their unusual behavior. First is the behavioral treatment. Operant conditioning techniques are used to mainstream autistic children. The result of the study are dramatic and encouraged as the intensive training groups showed gain in IQ, and behavioral treatment was found to be more effective than parents training alone. So early psychodynamic treatment were based on the belief that autism is the result of improper parenting. So it was found that treatment based solely on ego development and it doesn't have a positive impact on the lives of the autistic. So greater success has been found to be achieved through behavioral approaches than focus on skill development and behavioral treatment. So the first skill development that was used with the autistic children was to imitate other people's speech, which can be achieved through reinforcing the child with praise. No one medical treatment has been found to cure autism. So medical interventions have led little success on the core symptoms of social and language difficulties. A variety of pharmacological treatments are used to decrease agitation, and major tranquilizers and serotonin specific reuptake inhibitors also found to be effective in treating autistic. Autism may result from a variety of deficits. It is unlikely that one drug will work for every autistic. The most common medicine that was used for treating this disorder is haloperidol, an antipsychotic drug that is used in treating schizophrenia. Some studies have shown that this drug reduces social withdrawal, stereotypical behavior, and such maladaptive behavior such as self-mutilation and aggression. So drugs that reduces the action of serotonin are used in the treatment of autism. So researchers have found that naltrexone, an opioid receptor antagonistics, reduce hyperactivity in children with autism, and it produces a moderation in the imitation of social interaction. Summary: autism is found to be most disturbing disorder among children than other childhood disorders. This is according to DSM-4, described as pervasive developmental disorders. Autistic show marked impairment in social skills. They show deficits in establishing social relationship with other people, and they do not use non-verbal cues such as eye contact. So they do not establish eye contact with others. So they have the poor language skills. They do repetitive patterns of behavior. These children seem to live in their own world and they show no interest in other people. So they live in their own world. They do not like to mix with other people. So behavioral dysfunctions are found to be in them. So the repetition, their frontal lobe is less developed. Psychological treatment was found to be useful than medicines.